Okay. Hey everyone, so today I'm going to be giving my presentation on hepatitis B. So hepatitis B is a viral infection that is caused by the hepatitis B virus, or HBV, which is a DNA virus in the Hepatinaviride family. It primarily infects the liver cells, and although the virus enters and replicates inside the hepatocytes, it doesn't directly destroy them. Instead, the liver damage happens because of the body's immune response. HBV is one of the leading causes of chronic liver disease worldwide. This includes cirrhosis and hepatocellular carcinoma. Depending on the immune response, the infection can either be acute or progress into chronic disease. So the mechanism of hepatitis B begins when the virus attaches to the NTCP receptors on the hepatocytes. After entering the cell, the virus creates what's called cccDNA inside of the nucleus, which serves as a template for viral replication. As viral proteins are expressed on the hepatocyte surface, the immune system recognizes them as foreign. Cytotoxic T cells then attack these infected cells, which causes inflammation, necrosis, and apoptosis. So again, it's the immune response, not the virus itself, that causes the majority of the liver damage. So when looking at transmission, hepatitis B is transmitted through blood and bodily fluids. The most common mode of transmission globally is mother to child during birth, but horizontal transmission can also occur, especially from child to child. Inadequate sterilization of healthcare instruments and contaminated blood products remain major concerns in certain regions. Because of how easily the virus spreads through fluids, prevention and hygiene practices are extremely important. So, these are just a few of the common signs and symptoms. So, jaundice, fatigue and weakness, nausea and vomiting, abdominal pain, and hepatomegaly. So diagnosis is based on clinical presentation history and serologic testing. So some of the common key markers include HBsAg, which appears early in infection, anti-HBs, which appears during recovery or in vaccinated individuals, HBeAg, which indicates infectivity and may signal chronic infection if it remains positive for more than 6 months, HBV DNA levels, which help determine viral load. Ultrasound or biopsy may also be used to assess the extent of the liver damage. These tools help determine progress and prognosis and guide treatment decisions. The age at which someone is exposed to hepatitis B plays a major role in how severe the disease becomes. Infants and young children are at a higher risk for developing chronic hepatitis B because their immune systems are not yet fully developed. In fact, about 90% of infants infected with hepatitis B will develop chronic infection. Children under the age of 5 also have a higher risk, while most adults, around 94 to 98%, recover completely. Older adults tend to experience faster disease progression and worse outcomes due to age-related immune decline and comorbidities. The prognosis depends on several factors such as the age of infection, the immune response, and the presence of comorbidities. Most adults do recover fully, but chronic hepatitis B can lead to further complications such as cirrhosis or hepatocellular carcinoma. Lifestyle factors such as alcohol use or metabolic disease can accelerate liver damage. In advanced cases, liver transplant may be the only option. The prognosis varies widely from person to person depending on how effectively their immune system responds to the HBV. Medical treatment may include antiviral medications that suppress viral replication. Some patients are treated with pegylated interferon for about 48 weeks, especially if their liver enzymes are elevated and they do not have cirrhosis. Nucleoside analogs are another option, and these tend to have fewer side effects, but they do require long-term use. Although we do have effective treatments, none of them fully eliminate the cccDNA, so chronic cases do require ongoing monitoring. It can cause many different impairments because the liver plays such a crucial role in metabolism and detoxification. Some of the common impairments include fatigue, weakness, reduced endurance, jaundice, abdominal discomfort, hepatomegaly, muscle wasting, and a weakened immune response. These symptoms can significantly affect a patient's daily function and overall independence. As the These impairments progress, patients may experience functional limitations such as difficulty ambulating, decreased ability to bend or lift, and reduced tolerance for normal physical activity. In severe cases, chronic hepatitis B can lead to disabilities. For example, patients with hepatic encephalopathy may have confusion and memory loss, which affects driving, medication management, and also overall safety. Some patients may lose the ability to work due to fatigue or the complications. So some of the common PT interventions, therapy is individualized and it progresses based on the tolerance of the patient. But these are common interventions and they include energy conservation and pacing. Like this is a very important one because these patients do get fatigued and weak very easily. Gait training for impaired mobility, light strengthening based on the patient's tolerance, breathing exercises for endurance, and patient education. So some precautions and considerations for physical therapy are you want to make sure that you're monitoring signs of hepatic decompensation. So these signs include jaundice, confusion, and bleeding. You want to be cautious of any blood and bodily fluids to prevent the spread amongst yourself and other patients. And I put the HPV vaccine on here because it is highly recommended worldwide for healthcare professionals to get the HPV vaccine to take the proper precaution in preventing the spread of HPV. In patients with severe coagulopathy, high resistance and manual techniques are contraindicated. Coagulopathy is a medical condition in which the blood's ability to form clots is impaired, so these patients are at an excessive bleeding and bruising risk. So this is very important to keep in mind when treating patients with HPV. So I just included a little conclusion. This is just important key takeaways that I felt like were useful to consider. So hepatitis B ranges from mild acute illness to severe chronic disease. Early detection and treatment do improve outcomes, and PT plays a key role in endurance, enhancing mobility, and education on pacing and safety. Prevention through vaccination and infection control is very essential. Thank you so much for watching, and I look forward to answering any questions you have.